Hey guys, my name is Farooq. I'm one of the recent graduate from Henry Ford Health System. I did my combined training in nephrology and critical care, graduated last year, and currently working as an intensivist as well as a nephrologist here in Southeast Health Hospital in Missouri. The reason to make this video is to give you a little bit perspective about this program, as I do not know how the match process is going to go this year or in coming years, whether you guys will be appearing for in-person interviews or the Skype interviews. But either way, you want to know about this program as you guys are applying. I would talk about start with nephrology and critical care since I did combined training. Um, it was one of the first few programs in the US which introduced this combined specialty, and then has been working really great. It's been there for the last 10 years, and a lot of other programs are actually adapting to this combined track. So it's been working really well, and a lot of the recent and old graduates are working in both an academic and private setup successfully. The training about this program is really great in terms of like you will have an opportunity to work with both like pioneers of both fields on the both sides, and either if it's either inpatient or outpatient, you will have a lot of learning opportunities, and the best thing about the program is like the faculty is interested in teaching, and they will make you learn if you want to learn. Whether those are like core concepts of nephrology, like minute calculations of like dialysis, as well as like CRRT, um, you will get a really good training. And I would say that by the end of 3 years or by the end of 2 years of nephrology and 1 year of critical care, you will feel yourself like as a well trained person, ready to take up any situation, and ready to see like variety of severity of the patients. We have good patient exposure in CKD clinics as well as PD clinics, outpatient dialysis clinics. So you will learn nephrology in all setup. And to mention about the teaching, I would say the lectures we used to get in our noon conferences were really great, and including from our permanent faculties from Henry Ford Health System, like guest speakers, and all those lectures are like recorded in Panopto, and you will be able to learn from those even during training or after training. As right now, as I'm graduated, but still, if I need some reference from somewhere, I just go back to those lectures. I still remember that one of my friends recently called me and asked about those hyponatremia calculations, and I just referred him to Dr. Novak's lecture, and he did fine from there. So I would say, I mean, it's a really good training program in terms of that you have a really good teaching experience as well as learning experience, and this program prepares you really well for like independent practice. You also see transplant patients as well, and you do like quite a bit of rotations in transplant, and by the end of your training, you feel like are you are able to provide like initial management for the transplant nephrology patients until they get to the transplant centers to be seen by transplant nephrologists. Then we have other electives as well, like plasmapheresis, interventional nephrology, and if you guys want to learn about that, you will still be able to learn a great deal of things about these subspecialties in theirs. Um, Other thing regarding like work-life balance as well as like call schedule, I know nephrology is very busy specialty in rest of the other places, and to give you a little bit insight about it, that it's well balanced in terms of the workload, as we have like different three teams, so that all the workload has been shared together, and your training is focused more on AKI patients, to learn about these patients rather than just seeing ESRD dialysis patients, which after some time, I would say, would become a routine, and wouldn't be that much learning on those cases. Um, Call schedule, there's not a like a whole lot. I would say maybe like 3 to 4 calls per month, depending upon like the amount of fellows we have. But you just take like home calls, and in my 3 or 2 years of nephrology fellowship, I maybe just have to come like 1 or 2 times in the hospital to see those patients, and to actually like place the line and start the dialysis on those patients. But otherwise, you have a lot of other support staff that will be able to help you out with that, or your fellows that will be able to help you out with that. So I think with this training program, you will be able to keep a good work-life balance. That is really important as well, since you are getting trained as well as maintaining your normal routine life, to, to, to continue with that. So overall, I would say, if if I were given a chance again, to choose which specialty I would go, and which program I would choose to be trained, with no reservations, I would definitely go for this program, and I would highly recommend this program, because the way this program prepares you and helps you in in achieving your career goals, as well as preparing you for independent practice. It's great. It's great. My opinion or my advice would be, you would never have any regret if you join this program, and I would highly recommend you. All right. Good luck. Thank you.